This morning we are here to hand over a consignment of clinical equipment that include 120 oxygen concentrators, a consignment of antigen rapid diagnostic tests, a consignment of an assortment of personal protective equipment for use by the ministry, by the frontline health workers in the ongoing COVID-19 response. I would like to take this opportunity to congratulate and applaud the government of Zimbabwe, the Ministry of Health and Child Care, for the very strong leadership they are providing in leading all of us, the country and the partners in the response to the COVID-19 pandemic in Zimbabwe. We'd also like to appreciate the enabling environment that government has provided for different partners and stakeholders and everybody in society to contribute to the COVID-19 response. Today, I would like to appreciate the generous support from the African Development Bank, which has made all this consignment possible. And we know that this is just the beginning. Additional consignments will be arriving with the generous support from the African Development Bank. So we really express our appreciation to the African Development Bank for this consignment. We also take the opportunity to appreciate all the other donors who are complementing government's effort in different ways to support this response.
This gesture shown by the African Development Bank is just continuing to remind us that as Africa, we are one. I know there is a second project that ADB, or a project that ADB supports together with WHO, SADC, to the tune of almost 2 million. It really shows that we are one people, the function is the same. And this COVID-19 disease is helping us to remember that we are one people and we should fight together to defeat this disease. And like you have said, you are supporting all African countries and we are just one of those being supported. And it's important also that ADB representative, he should be here, but I want to thank them very much because I also noticed that you are supporting Zimbabwe to the tune of 10 million in buying these PPEs and all that, and even supporting Harare and Bulawayo itself in terms of managing this deadly virus. This is quite commendable, and I'm not surprised that these things have come and they are going to help the majority of our people, and I can assure you, Dr. Gasasira, they will be put to good use, and we will make sure everyone is accountable. We will not allow any misplacement or pilferages of these things. People will be dealt with sternly if the people try that. So we definitely want to appreciate the 120 oxygen concentrators. The virus or this disease depends on oxygen. People get shortage of supply of oxygen. So these have come in handy because our patients and our people now have oxygen handy, and this is a welcome donation. And these antigen tests, 120,000 of them. I'm sure our Dr. Raiva Sibi is very pleased and is very happy to have such a consignment in his hands. Testing is one of the most important ways of trying to curb this deadly disease, which is all over us. So we want to thank you once more, and the African Development Bank. Also, you gave us these wonderful instruments. They help to protect the health workers, our frontline workers. We need to give them the best that we can, because if we don't, then we lose our frontline workers and we lose the battle against the virus. So the virus, we are fighting it from all angles, and there are some face shields that will also help us to protect the frontline workers from splashes and whatever might happen. So this is a welcome thing, and we are definitely very impressed and hope that we continue working the cordial relationship which is there between the WHO and Zimbabwe should continue, because WHO, we are saying we received our first donation from our friendly country or our best friends or our friends, the People's Republic of China. They gave us the first consignment of 200,000 Sinopharm vaccine, which WHO has already approved. So we are saying WHO is playing a major role in the fight against this disease. WHO is the organization that named this particular problem COVID-19. So we are saying everything that we are doing, we are also going to follow science, follow WHO's guidance, and this is going to continue.